So I'd now like to introduce our Advancing the Connection Between Civic Engagement and Health panel. As a social worker, I see the way that government can have a huge impact on the health of individuals. And so here to draw a little bit more on that connection is our great moderator, Jessica Barbara Brown from Healthy Democracy, Healthy People, who will be leading the conversation between Al Schmidt from the Committee of 70, Dr. Nate Chomilo, that great funky move we saw from Dr. Chomilo, awesome. The medical director for the state of Minnesota's Medicaid and Minnesota Care programs, and general pediatrician with Park Nicollet Health Services Health Partners. We also have Rear Admiral Paul Reed from the Department of Health and Human Services. And as you're listening to these speakers, keep this question in mind. How have you seen local, state, or federal levels of government impact the health of your patients? So I'm going to pass things off to Jessica.
Awesome. Thank you so much, Lee. Thanks for giving us a little energy boost coming into this session. Hello, everybody. So glad to be here with you. Thank you so much to our fantastic partners, Vot-ER, for putting on this conference, for putting on Civic Health Month. We're really excited to be here today and excited for this fantastic panel that we have talking about advancing the connection between voting and health. So I'm going to get us started with just a few slides. I'm going to give you a little bit of background about healthy democracy, healthy people, talk a little bit about just what is this connection between voting and health. And then we're going to get right to our fantastic panel. So as we all know, and as we've talked about a little bit already here this morning, 2020 was really a year that brought public health and elections together. You remember there was the massive, pandemic that was unprecedented, and there was, the largest presidential election that we've seen in modern times. And so the collaboration that came out of 2020 was really powerful in terms of how do we get public health to really show up for elections and for safe and healthy voting, and they came up in a big way. So from that, we really evolved this into the Healthy Democracy, Healthy People Coalition. I am naming here, and you can see on this slide a lot of the organizations that are part of this. These are basically the major public health associations that have individual members in states. And so perhaps some of you are members of some of these different public health associations, and we're really just grateful for all of the collaboration with our partners and how they're showing up for democracy and for health. So the core concept here, and we've talked about it in a number of ways, and we're going to hear even more evidence, and people have already been posting studies in the chat. But the core concept here is that health and democracy are interdependent. And why is that? Because we do know that when there's higher voter participation, when we have communities at the table who are making decisions, who are in power for their own, healthy futures, they have power to influence policy. Policy means more health resources. Now that can mean things like specifically health resources, like for Medicaid, for hospitals. It could also mean things like clean air, clean water, food distribution, transportation. Those are the social determinants of health that we know have a huge impact on community health. And when people vote at higher rates, they also have greater social cohesion. So there is the sense that they are a part of a community that has power, that is moving resources. All this leads to better health outcomes. Communities that have better health outcomes have higher voter participation. So it is this virtuous circle that we see in the literature, and we're going to talk a little bit more about how can we kind of take this concept and really advance it in all of these different levels. And that's what our panel is going to address in a little bit. We at Healthy Democracy, Healthy People Initiative have come up with a tool here. This is some research that we've done that compares different public health indicators, about 12 public health indicators, with voting access. And it shows that states that have more voting access and greater civic participation, they have better health outcomes. So I encourage you to check out the Health and Democracy Index. Check it out for your state, like see where your state falls in terms of the public health indicators and the voting access. And, we definitely encourage you to share that information. We also have tools. We have healthy voting guides. These we launched in 2020. Again, this was very much in response to the pandemic context when a lot of people were navigating different, voting options for the first time. And now what healthy voting guides are, they're state specific, they're nonpartisan, and they're health oriented guides. They're about voting as an act that promotes health. And it allows voters to learn about their options to vote by mail or in person. And so definitely also check out the Healthy Voting Guide for your state, and please do, discuss ways to share that around. And we really thank Vot-ER for being a fantastic partner on that. I want to make a point that when we're talking about, which communities have better health outcomes and more access to voting, we're not just talking about this, sort of blanket, right? There is a difference, there is disparities by race and ethnicity. And we know that also affects the health equity goals that we all have as health professionals. And so here you see, this is turnout by race and ethnicity. And you see a disparity between communities of color and white communities. And we need to be closing that gap so that we are also taking into account how that affects the health outcomes of these populations. So some things that we can do, and again, we're really going to get into the weeds on this with this panel. We're talking about policy interventions at the federal, state, and local levels, and you're going to hear some really fantastic examples of that. We want to measure voter participation as a public health goal. And Rear Admiral Reed is going to talk about how we're doing that at the federal level. Offering voter registration and healthcare services. So many of you are already part of this great work. And, again, Vot-ER has done such a fantastic job in terms of making sure that we can integrate that voter registration into our points of contact with the community. And that also goes for public health. There's a lot of points of contact with public health that we want to see that voter registration be incorporated into. And again, highlighting that connection between voting access and health outcomes, using that Health and Democracy Index, and educating the public with your state-specific healthy voting guides. So those are some things, we'd love to get you involved in our initiative. There's a bit.ly link that you can sign up for. I'll put that in the chat afterwards. We also have Nora Gumanow. I think she's on the call right now. Nora at hdhp.us. So please feel free to reach out to her and follow us on Twitter at hdhp_initiative. So with that, I am really pleased to turn it over to our first panelist. And we've had the pleasure of working with Rear Admiral Paul Reed. He is the Director of the Office of Disease Prevention and Health Promotion, and he is the Deputy Assistant Secretary for Health at the U.S. Department of Health and Human Services. And he's been a fantastic champion on this, on advancing the connection between health and voting. So I will turn it over to him right now.
All right, Jessica, thank you. Can you hear me okay? All right, great. And while you're pulling up my slides, I'll acknowledge in all transparency, I was dancing off camera. I just thought it'd be a little bit off protocol to be doing it in uniform on camera. So thanks for that. I really appreciated the mindfulness session. Okay, so good morning or afternoon, as the case may be for you. I really appreciate the opportunity to join you all today and provide some thoughts from our perspective at the Department of Health and Human Services to what we consider as a very important and timely subject. So the fact that this forum is taking place today and this month and this year, I couldn't be more excited about, particularly as it relates to some of the things I'm going to talk to you about now, including the measurement of this issue, like it was just spoken to a minute ago. Next slide. So to best understand our role regarding the relationship between civic participation, including voting and health, I thought I'd briefly share a few thoughts on two different initiatives that our office has been responsible for, one for a number of years and the other for just the past couple of years. And those are Healthy People 2030 and the Federal Plan for Equitable Long-Term Recovery and Resilience. Now, at the beginning of every decade since 1979, Healthy People provides a comprehensive set of science-driven, measurable objectives that have 10-year targets. And we utilize it to assess progress towards achieving objectives over each ensuing decade that Healthy People manifests. Our office, ODPHP, or the Office of Disease Prevention and Health Promotion, facilitates both the development of Healthy People as well as its implementation on behalf of the federal government. But we do so in partnership with many, many different partners inside and outside of government. Healthy People genuinely is the cornerstone program that establishes measurements for HHS strategic initiatives based on public health priorities and provides a framework for prevention and wellness programs for a variety of public and private organizations, federal and non-federal agencies, and many other entities. The objectives in Healthy People and the relevant combined data represent collective input from federal, state, and local governments and other public and private organizations. Now, ultimately, these objectives and data are organized to help further the Healthy People 2030 vision of a society in which all people can achieve their full potential for health and well-being across the lifespan. And the evolution of Healthy People's overarching goals reflects growing awareness of health inequities and the drivers of those inequities, largely as they are manifest in the social determinants of health, as has been more than alluded to already here today. And as such, the focus of Healthy People has shifted over the years to not simply aiming to reduce health disparities, but to eliminating health disparities, as well as more broadly integrating health equity across all the objectives and expanding the scope of Healthy People to define and measure concepts such as well-being. Now on this slide, to fully grasp the breadth of all of this, it's important to first understand the framework and elements of the social determinants of health, or SDOH, which I know most, if not all of you, are quite familiar with. As we define it, SDOH are the conditions and the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. And the initiative's framework organizes SDOH into those 5 domains, which you see here, one of which is the social and community context of our lives that features civic participation as a key factor influencing health and well-being. And next slide. So to pivot just a bit, in addition to the 40+ year history of supporting Healthy People, ODPHP will soon be publishing on our website, health.gov, a new whole of government federal plan for equitable long-term recovery and resilience, an initiative that has grown from an absolutely extraordinary effort by nearly 140 senior career staff from across more than 35 federal agencies. And the plan seeks to align federal resources and actions, outlining strategies to improve vital conditions, which you see depicted here, support recovery from the myriad impacts of COVID-19, and positively impact individual and community resilience, in part defined in terms of health and well-being, and do so with an intention towards sustaining such outcomes over the next 10 years and well beyond. And the strategies in the plan aim to identify interdependencies, increase coordination, and remove barriers to foster long-term contributions by the federal government in better harmony with civil society towards community resilience as the ultimate goal. And just as Healthy People 2030 underpins far-reaching public health strategies, the Vital Conditions for Health and Wellbeing framework forms the organizing basis for the Equitable Long-Term Recovery and Resilience federal plan. And this framework is an even broader, more inclusive model, which encourages a cross-sector approach to improving community health and well-being, and will help identify where and how to invest in communities to yield better, more sustainable results over time. And absolutely central to this framework, with these 7 vital conditions for health and well-being, which you see depicted, is belonging and civic muscle, which you see at the center of the graphic there, which is defined as a vital condition for thriving that demands possessing a sense of belonging and power to shape a common world. And some of the characteristics of belonging and civic muscle most relevant to our conversation today include civic agency, civic association, perceptions of collective efficacy, equitable access to information, opportunities for civic engagement, and support for civil rights and human rights, I think many of which have already been touched on by our speakers so far. Next slide. Okay, so that brings us to ODPHP, our office's part in today's conversation, and arguably that of HHS and the whole of government. As you've heard and will hear, the evidence shows that voter participation has important connections to physical and mental health and well-being. And voter participation is associated with outcomes including self-reported health, physical disability, mental health, risky behaviors, and specific health outcomes like child inpatient bed day rates. And because of the strong connection to health, Healthy People 2030 the current iteration of Healthy People, has recently added a new research objective to the initiative, which you see here, namely increasing the proportion of voting age citizens who actually vote. And the aim is to bring attention to this factor as a key public health issue, as well as to the value of assessing civic participation among eligible voters as an indicator of well-being in the nation. And highlighting gaps in eligible voter participation is essential to advancing equitable access to voting. As I mentioned, the Healthy People Initiative embraces the importance of tracking social determinants of health broadly to understand the interrelated nature of complex community systems and health outcomes. And enhanced voter participation and its relationship with improved health and well-being is absolutely important part of that story. And this new objective currently is designated as a research objective. And what that means in terms of Healthy People 2030 is that this is considered a high priority public health issue, but one that doesn't yet have evidence-based interventions developed to address it. And it may or may not have reliable baseline data available as well. However, as baseline data and evidence-based interventions become available, this objective may become a core measurable objective for Healthy People 2030. And that possibility is actually currently being entertained and debated. And we should be seeing some movement on that in the months to come. In addition, as I mentioned, belonging and civic muscle are central to the tenets underlying the equitable long-term recovery and resilience federal plan. And voter participation is an indicator of social power and social cohesion, as you've heard. And social cohesion, as we understand it, has been found to be a protective factor that helps with resilience. Strong voter turnout indicates individuals want to affect change and feel empowered to take action, or in terms of the vital conditions framework, demonstrate that belonging and civic muscle. From a public health perspective, strong voter turnout may also indicate that a community is ready to address the complex issues affecting health outcomes. And participating in voting provides an opportunity for the public to have a hand in shaping policies and legislation that influence health equity, impact disparities, and ultimately contribute to health, well-being, resilience, and thriving, which, to the point of one of our earliest speakers, really is the end game and the purpose of government as far as we're concerned. So with that, I'll turn it back to you. Thank you very much, and I look forward to the questions.
Wonderful. Thank you so much, Dr. Reed. That was fantastic. And we will be coming back to you when we get to our questions. But next, I'd like to bring up Dr. Nathan Chomelo. He is the medical director for Minnesota's Medicaid and Minnesota Care programs. And he is also representing here today Minnesota Doctors for Health Equity and as a practicing clinician. And we're just so pleased to have his participation and his perspective from the state level. So Dr. Chomelo.
Yeah, thank you. Can you guys hear me? Perfect. Happy to be here and talking a little bit about some of the work we've been doing here in Minnesota and giving kind of both a state perspective from state government, but also from what kind of statewide organizations can be doing, particularly in the healthcare space. Because we know in the US, voting's long been a right that has been intentionally oppressed along lines of gender and race, and that voter disenfranchisement is perhaps one of the most clear examples of structural racism. And this legacy remains evident today and continues to impact the health of our communities. Like Jessica was talking about in a lot of the great data they've put together there, you can quite clearly see states with more inclusive voting policies and greater levels of civic engagement have been found to be healthier. And those policies include things like automatic or same day and election day voter registration, no excuse absentee and mail voting, and restoration of voting rights post-incarceration. Those have all been found to contribute to decreased disparities in public health measures like infant mortality and greater risk of chronic illness. And conversely, policies that constrict voting access like restrictive voter ID have been associated with states with lower self-rated health, higher premature mortality, and more poor mental health days. And quoting something from the Health and Democracy Index that found that rates of infant mortality are higher among Black and American Indian communities than white communities, and this disparity shrinks for all racial and ethnic groups in states that have better civic participation. And so from a state perspective, there's steps that we can take to improve access to voting through a number of systems, including the healthcare system. The National Voter Registration Act of 1993 allows nonpartisan voter registration in any venue where public assistance is provided. And most commonly, that act and some of the levers taken reference things like the Department of Motor Vehicles and incorporating automatic voter registration at a time of driver or other licensing and renewal. However, Medicaid enrollment and places where Medicaid finance care is provided is one area that's been explored to incorporate practices like automatic voter registration. And this is actually one way to think about addressing racial equity in voter registration. We'll take Minnesota's example here. When we've looked at our data, not only amongst our enrollees, because if you look at our enrollees, roughly 15–16% of Minnesotans on Medicaid identify as Black versus about 7% in the state. But if you look across the state at how Black Minnesotans, for example, get access to healthcare, we find that the number is actually significantly more impactful for the community. So roughly 44% of Black Minnesotans get their care through Medicaid or Minnesota Care, basic health plan. And so if you take that same lens and look at those of the voting population that Medicaid covers, primarily those 19 to 64, 34% of American Indians in Minnesota get their coverage through Medicaid. 31% of Black Minnesotans in that age group get their coverage through Medicaid, 17% of Hispanic or Asian Minnesotans, and 9% of white Minnesotans. And so if we were to implement some automatic voter registration enrollment, that would immediately be covering a large number of Minnesotans from a lot of the communities that have historically been disenfranchised. So we currently don't have this, and part of it has been just logistical issues. Registration data needs to be transferred between Medicaid and other state departments to facilitate that. Electronic data transfer helps that be done more quickly and accurately, but there needs to be existing data use or sharing agreements and systems in place. Other states that have tried it, have come upon things like restrictions in application methods. The different types of Medicaid programs have different types of applications. So some are allowed to do online, some have to be done by paper. If you're registering for a whole household, how do you make sure that everyone in the household is an eligible voter? And so, but that's all to say that there's obstacles there, but folks have thought about them, and I think we just need continued action and pressure from communities, from healthcare institutions who have lobbying arms to say that this is something that we think would help improve civic engagement, that would improve our overall civic health, and help states and folks working in states be held accountable to making that happen. The last piece I want to touch on in this intro here is just talking about voter registration discussions in the clinic. That's something that I wasn't trained at in medical school or residency, how to talk about voting or how to talk about civic engagement. And that's something that in our role with Minnesota Doctors for Health Equity, which is a statewide organization of physicians and health professionals that has really stepped into a space to try to educate and activate clinicians. There's a role for other large physician and other healthcare provider organizations to step in and help provide that training, those resources to how to talk about voting and impact of civic engagement on health, and why the clinic space is an appropriate place for those conversations. So I will certainly dive in more in the questions we got coming and look forward to the conversation we have.
Wonderful. Thank you so much, Dr. Chomolo. Now I'd like to introduce Dr. Al Schmidt, President and CEO of the Committee of 70 and a former city commissioner for the city of Philadelphia. Thank you so much for joining us.
Also, in the interest of full disclosure, I'm a doctor, but I'm a PhD in political history. So I am a completely different type of creature here on this panel. So and I never use that title. So this is the first time probably since I got my PhD in 2000 that title's ever been used. So I'm grateful it came into use here. My name is Al Schmidt. I was election commissioner of the city of Philadelphia for the past 10 years. We're elected in the city of Philadelphia, and we're elected in a sort of partisan election. And I was a Republican election official in Philadelphia, responsible for running elections, anything related to elections, from tooth to tail, from voters registering to vote, to mail-in ballot, absentee ballot voting, to election day operations, to the final tabulation of the results and certification of who won and who lost and how much. And my view, unlike my colleagues, is very parochial. But in a sense, it's sort of no less compelling because we're interacting with these sort of voters in a day-to-day sort of way. And in those 10 years, I was motivated by a couple of experiences, and I just want to share one that's made this so important to me. Now that I've left public office and I'm heading a nonprofit in Philadelphia called the Committee of 70. And like the name suggests, we have 70 board members, which is a lot of board members. But the good news is we also have Penn Medicine on our board. We have Temple University and their health system on our board. We have Jefferson Hospital and the others on our board. So I was in a position to do sort of one side of this before, and now I'm really driven to do what I can on the outside. And one thing that was really motivating to me that I want to share is in the 2016 presidential election cycle, we had a young medical student all day long running between hospitals and patients and the Board of Elections and City Hall to help voters vote. At the time, the law was that voters can vote by absentee ballot, emergency absentee ballot, if they fill out an emergency absentee ballot application and designate someone else to essentially assist them to take their application to the Board of Elections, to election court in City Hall. And then, if approved, take the ballot back to the voter completes it and then takes it back to City Hall. As you can imagine, this was a very busy day for this young student, and the sort of vision of her running down the hallway between election court and our Board of Elections office and out again to patients was a very memorable one for me. Every bit as memorable was in election court, where lawyers for one party, my party, were seeking to prevent those voters' votes from being counted, because the law at the time said that you could only vote by emergency absentee ballot if there was indeed a medical emergency. And if somebody had scheduled a hip replacement surgery a month before election day, they're a hospital on election day, but the argument was that it was not a medical emergency. That voter supposedly should have known or paid attention to the fact that they'd be in the hospital on election day. That was, I think, a despicable approach. I had my department oppose that in court. And fortunately, the judge agreed with us. There was no question about the eligibility of the voter. There was no question about whether it was the voter's vote. No question about whether that voter had filled out a designation form to have somebody assist them. So it was really very much at odds with the spirit of the law. And we fought that and won. But what was also apparent is that it was being done very sincerely and in a very determined way, but not really in a systematic way. This is a young medical student on her own, running back and forth between City Hall and neighboring hospitals in Center City. What I would like to see, and what I think we might be able to talk about a little bit later, is how this can be done in a more systematic way so that hospital systems can prepare for election day, in our case, 2 days a year, primary and a general election. So we can pursue this in a way to maximize the number of voters who can cast their vote during what is undoubtedly a difficult time and the hardest time to probably cast a vote, and the people most in need of assistance around election day. So that's my goal in the nonprofit sector with our organization, with having on our board these hospital systems, to do what we can to make sure our voters can cast their votes and not encounter barriers to voting.
Thank you so much. Powerful story, and really appreciate you being here and sharing that. I'm seeing we have about 15 minutes for our panel Q&A, so let's get right to it. So I'd love to just start out with, this panel is about advancing the connection between voting and health. And, Dr. Reed, you mentioned earlier about that we're still forming this picture of what is that relationship, what is the evidence between voting and health. So in your opinion, from your vantage point, what are some of the most powerful proof points that really show that relationship between voting and health?
I appreciate that. I think well, very much the Health Democracy Index is probably indicative of that. And I don't mean to sell your product, but I really believe having that collective data that's reflected on communities at a relatively local level is going to be the most telling. It's also going to be the point, I think, that is most well received by policymakers. I think it's easier to depict that than it is more discrete data that maybe is even diluted out across the nation. So we need to demonstrate communities' needs as best we can in whatever ways we can at the most hyperlocal level in order to fully understand what's going on in terms of health inequity and everything else that goes along with it, inequity in general. To that, I think collecting diverse data that paints as broad a picture of communities at such a local level and presenting it in a way that's reflective of their voting capacity and civic engagement otherwise is really the most telling.
Wonderful. Thank you so much.
So I'm going to jump in.
Yeah,
here
please.
To answer this question. I know we're a little short time, but I think there's a really compelling case if you look at Medicaid expansion through the ACA. Right, and the benefits of Medicaid expansion and how it's helped decrease some gaps. It hasn't been perfect. It hasn't solved all the problems, but it has moved the lever on decreasing gaps in access to things like cancer care, some maternal health indicators. And the fact that there's a handful of states that only got there because of ballot initiatives. And so that is because the legislatures and the governor's offices do not pursue the expansion through of Medicaid through ACA, that it was taken to the voters, and then the voters themselves superseded what the representatives and the political leans of those representatives were deciding around access to healthcare. And so I think it is really clear just from a policy perspective, and then you can look at all the research that's been done since the ACA has been enacted on how it's addressed health, that voter engagement, voter participation is crucial to even just getting access to healthcare, let alone the broader question of health.
Absolutely. Thank you so much for that. And just maybe to stay with you for a moment, Dr. Chomolo, would love to hear about, and people were asking in the chat about like undocumented folks or non-citizens and how do we involve them in this conversation. And we talk about civic engagement as not just voting, but really this kind of broader idea of civic involvement, things like completing the census and this idea of social belonging. So I'm just wondering if you could just talk a little bit about why is that concept at the core of the social determinants of health, and how can we sort of bring that holistic idea of like social belonging, social cohesion? Why is that kind of at that core of the social determinants of health?
Yeah. I mean, if you look at the social determinants, or I'm leaning more towards calling them social drivers because they're not determined as much as how they drive the impacts. Those are really come out of community and decisions that community makes or folks make for communities as far as access to resources, what's being prioritized along things like housing and education, public safety, nutrition, environmental and climate change. And so, those, if you are engaged in your community, and if you are engaged in those conversations, then you're more likely to understand the process and the levers you want to pull to get yourself, your family, your community, the resources they need to thrive and be successful. And that is, and so voting is one part of that, but as has been mentioned in the chat, it's not only the only part. And I think as we think about how healthcare can really be a part of that greater, healthcare, particularly a larger health system, have an opportunity to, build the tables where we're bringing together, clinicians who can talk about the health and what, drives health, and other, public health practitioners that can bring civic leaders and community members, whether they be voters or not, to kind of talk about what are the issues and how do we move forward together, how making sure you're voting and showing up so that those civic leaders that are at those tables are held accountable, but like that there's other ways to engage civically in the health of your community, and give folks, that opportunity. And because everyone at some point in their life ends up, coming across a healthcare provider, making our job to make sure that they're aware of that those spaces exist, that those levers exist, and see if there's ways we can help get them there, or at least bring their concerns to those spaces as clinicians advocating on behalf of them.
Thank you so much. I don't know if Dr. Reed or Al, if you have anything else to add to Dr. Chomolo's remarks.
Yeah, I'll use the language of the framework of the vital conditions for health and well-being, which I talked about, to emphasize this same point. I hope that you're never going to see those other conditions, those other vital conditions improved upon if there isn't rich and deep and broad civic engagement on the part of community citizens. You're just not. First of all, those needs aren't going to be recognized and defined as they actually exist in those communities. And two, the policies to benefit them or the resources sought to act to improve those conditions are going to be out of balance. They're not going to be accurately applied. And that's at the local level right up to the national level. We need that common frame of reference at the local level, which is largely defined by the level of community engagement that takes place. And civic engagement and voting is a major piece of all that.
I would agree. I obviously agree with those comments, and I know we're almost out of time, but just sort of want to add that there's undoubtedly a benefit to mental health benefit and other sorts of benefits to social engagement. And one advantage to having a PhD was you read a lot of books. And I remember reading a book called Bowling Alone, which has a sort of silly title, but the idea is that, you used to have more people engaged in social activities. There were big benefits to that, mental health benefits, and all sorts of other benefits to especially keep people from becoming deceived and deranged by all sorts of misinformation and lies flying around. And one thing that you have with election day is a day or 2 days where you have people engaging in the same activity, that there is this level of social engagement on that day, assuming you didn't vote by mail or something else, and where you're participating in that undoubtedly has benefits for people that sort of pay dividends, and a feeling of community and having a say in the direction of that community, whether you win or lose.
Wonderful. I'd love to stay with you for a moment, Al, and just ask, from your vantage point, like especially when you were, serving as a city commissioner, I'm just curious, from somebody who's maybe outside of the health sector, what do you see as some of the most important ways that the health sector can influence this idea of boosting civic participation, within their sphere of influence? Like what would be your wish for what you would like to see the health sector do more of?
And it's something that I just mentioned in passing before, and I'll briefly mention again now, and what I'm looking to do with our board members who run hospital systems. And that is for whether it's nonprofits or, boards of elections to help to engage, members and people who work in the healthcare sector and prepare them for the election day window when it closes in. I could keep talking about in-person voting, but that's because if you can vote by mail, you can vote by mail on any otherwise given day. But right around election time, if you haven't voted by mail, it's too late to apply to vote by mail. And you're in the hospital and obviously can't get to a polling place. So I guess it's really doing what we can to help train, members of the health sector, so that they can prepare to engage with their patients during this critical, time-sensitive time where they can cast their votes, because obviously voting ends at 8 p.m. on election night, and there's no redos, there's no sort of catching up and doing it later. It's really obviously as important as it is time sensitive. So it's really our part in preparing them well in advance. Election days don't sneak up on anybody. We know when they are. They're notified a year in advance. So there's plenty of time to prepare for this.
Wonderful. So I'd love to hear some reflections on, I know it's amazing that there's, however many 200 people on this call, and we have this group of committed people who see voting as so important that they're going to take time out to, to be here to learn about this. And we know that, they're going to go back to their day jobs, and there's a lot of crises hitting at the same time. We've got monkeypox, we've got, COVID is still actually a thing. We've got, reproductive health care. We have a lot of other issues that are really confronting the healthcare sector right now, and people who work in health and public health. I'd love to hear some of your reflections about, why should folks still prioritize voting in the midst of all of that? What would you say to people who are kind of in that moment of, oh, this is great, but there's so many other crises that we're facing right now? Would love to hear anybody can respond to that.
That's a tough question to answer because the priorities are so real and they're so weighty. But I think taking advantage of the moment is a good argument to your point. And I say that because in as much as we all, each and every one of us on this planet have had our consciousness raised to the importance of our individual and our family's health and well-being through this pandemic, which I see as a very thin silver lining to it all. We've also had our consciousness raised to how policy and politics influence our health and well-being. Now, not all of us understand that in the same way, but we all have some awareness that there's this interplay there. And for the first time that I can remember, and I'm very much speaking from a public health perspective here, we're thinking about policy and politics as contributing factors for health. Whereas the legacy of public health has been talking about clean water and all those other, key elements that historically will never go away. But we know now that policy and politics, and maybe more so true in this country than in any other today, arguably it's true everywhere to a degree. We are better understanding that policy and politics maybe carries equal or greater weight than clean water, as an example. So we need to take advantage of that, and we need to amplify the conversation just as we're doing here, but maybe in a forum of lay people. Maybe it's the community of our patients or the community within which we live. We need to be having that conversation about, well, what does that mean? What does politics and policy and its implications on health really translate to? Not talk about it in the way we will here in a more sophisticated way, but break that down. It's very practical. And people are keyed into it, at least to some degree. So we need to take advantage of that.
Wonderful. Dr. Chomalo, last word from you.
Yeah, so I would say the clean water is a very apt analogy. Because you talk to communities in Flint and Baltimore, they'll tell you that well before the pandemic, they knew the impacts of policy and politics on clean water and public health. And you really can't address any of these bigger issues around equity and health equity and disparities if we are addressing structural racism. And structural racism has been implemented by controlling the vote, because A, that controls resources, and B, that controls accountability. And so I think if we really are wanting to be accountable to our own communities, we have to make sure that they are fully aware of and empowered to get access to the ballots, to get access to make sure that they are able to hold their leaders accountable, that their leaders know what is important to them. And that's kind of the core of the conversations I have is, what are our shared goals? What, when I talk to parents, what do you want for your children? Access to good education, healthy food, safe housing. And we know that communities that participate in voting have greater access to these resources, have more say in these resources. So I think it really is really at the beginning, and challenging healthcare and health systems who have lots of power, who have lots of lobbyists talking to elected officials about keeping their lights on and all the things they need to be competitive in a capitalistic society. How can they shift that to be talking about engaging community?
Wonderful. Well, I can't imagine a better note to end on. I want to thank our fantastic panel. Thank you for being here. And also just thanks for the incredible work that you all do every day. Thank you for advancing this conversation in local, state, and federal spaces. We're really grateful for your participation.